Today we're discussing the prostate. When should you have your first prostate exam? Why is it a rectal exam? What foods and lifestyle modifications are necessary to improve the health of your prostate? And what are the signs of an unhealthy prostate? Welcome to another episode of Getting Healthy with Dr. T, where I discuss using food as medicine and modifying your life for a better, healthier you. Let's get started. So the prostate is a part of the male reproductive system, and it is a walnut-shaped gland that wraps around the urethra. And the urethra is a tube where urine flows through. The main job of the prostate is to add fluid to semen and assist in the movement of sperm. The prostate gland has two main phases of growth. It starts out fairly small. Around the teenage years, it doubles in size, and then it starts to grow again around the age of 25. Prostate issues, unfortunately, are the most common conditions males suffer throughout their lifetime. The most common prostate conditions are prostatitis, which is an infection within the prostate, benign prostatic hyperplasia, which is when the prostate enlarges, also known as enlarged prostate, and prostate cancer. Prostatitis is more common in men younger than the age of 50, whereas BPH, benign prostate hyperplasia, is more common in men over the age of 50. And prostate cancer is thought to be a long-term complication of the two. So what exactly happens in these conditions? Basically, the prostate, because it surrounds the urethra, as you can see here, when it enlarges, it clamps down, causing a restriction in urine flow. This often results in frequent or difficult urination, trouble starting and stopping urination, urinary leakage, urinary tract infections, the inability to empty the bladder, erectile dysfunction, and most commonly, increased urination at nighttime. Prostate cancer is the second leading cancer in adult males, second to skin cancer. However, it is treatable if caught in the early stages. It is recommended to have your first prostate exam at the age of 50, unless you have a history of prostate cancer in your family or if you're showing signs and symptoms of prostate issues. The first test that's normally done in the doctor's office is a digital rectal exam. And why does it have to be a rectal exam, you ask? So what's happening here is the doctor is palpating the prostate, checking for soft or hard areas, trying to determine the size, basically just checking for any abnormality. The second test is known as a prostate-specific antigen test. And this test basically tests the antigens of the prostate within the blood. Normal levels are usually 4 nanometers per milliliter of blood. If it's found to be any higher than that, the doctor will most likely suggest a biopsy of the prostate. Now let's discuss foods that can improve and help keep your prostate healthy. Number 1, cooked tomatoes. Cooked tomatoes contain a powerful antioxidant known as lycopene. And there have been many studies that have shown that lycopene has the ability to decrease cell damage and slow down cancer cell production. There was a recent study that was conducted between men that consumed high amounts of cooked tomatoes versus men that really didn't eat tomatoes on a regular basis. And it was found that the group consuming high amounts of cooked tomatoes had a lower prevalence of tumor growth in the prostate area. Next, there's broccoli. Broccoli is a vegetable that contains many complex compounds that have been shown to protect against prostate cancer. There are other studies that suggest there's a link between those who consume vegetables on a regular basis have a lower risk of prostate cancer. Researchers believe that it's the phytochemicals found in vegetables that selectively targets cancer cells, leaving normal cells intact and unaffected. Next, there's berries. Blueberries, strawberries, blackberries, they all have high amounts of antioxidants that help to eliminate free radicals within the body. And free radicals are formed in our body on a regular basis and is simply a part of the metabolic process. Free radicals cause oxidative stress, which eventually leads to cell damage within our body. And the high amounts of antioxidants within berries help to remove the free radicals formed by oxidative stress. Next, there's green tea. And green tea has been consumed for thousands of years in Asian countries. It is not clear, but it is thought that green tea may be one of the reasons why prostate cancer rates are much lower in Asia than in the United States. Components of green tea are currently being studied for their effect on prostate cancer. Green tea contains a powerful component known as EGCG, It's one of the most powerful beverages you can have. Be sure to check out my video on the benefits of green tea. I'll link it here and I'll also put it down in the description box. Next, we have legumes such as peanuts, beans, and lentils. These are plant compounds that contain phytonutrient, cancer-fighting properties known to suppress tumor growth in prostate cancer cells. Next is pomegranate. And like green tea, it is full of powerful antioxidant. It is one of the most powerful fruit preventing chronic diseases caused by oxidative stress. Scientists believe that the antioxidants in pomegranate work in a seek and destroy method, meaning they're able to determine which cells are cancerous. They attack those cells, leaving the healthy cells within the prostate untouched. Next, we have fish. And I know you didn't think we were going to end this without talking about omega-3 and omega-6. These are essential fatty acids that are not synthesized by our bodies and have to be consumed within our diet. Having a healthy balance of omega-3 and omega-6 may help prevent the progression of prostate cancer. While food plays a major part in overall health, regular exercise is also a plus when it comes to fighting any type of disease. And regular exercise is defined as 30 minutes of physical activity 3 times a week. And physical activity helps by circulating the blood, allowing toxins and different cancers to filter throughout the blood. So regardless if you are already showing signs, not showing signs of prostate insufficiency, it is always a good idea to incorporate the above list of foods into your daily regimen. There are also many supplements and vitamins that can be incorporated into your diet and lifestyle to improve the health of the prostate. If you want to know more about those, make sure you drop me a comment below and be sure to share this with at least one male in your life. Prostate health is sometimes taken for granted by our male community, and it's necessary that we encourage our men to get checked out. Thank you for watching. I hope you found this very informative. Be sure to subscribe for more benefits on how to use food as medicine and lifestyle changes. Until next time, stay healthy.
Thank you for joining me. Be sure to subscribe, like, comment, and share. Follow me on Instagram at Getting Healthy with Dr. T.